Welcome to the Deep Dive. This is where we take your source material, could be articles, research notes, you name it, and we really plunge in.
Yep.
Our aim to pull out the key insights, those important nuggets, and maybe some surprising details too, all curated for you.
Basically, we do the sifting so you don't have to. We give you the essence, the takeaways, the really interesting bits of a topic.
Exactly. And today, well, we're diving deep into a pretty specific text. Our source material comes from William Boericke's Homeopathic Materia Medica. We're focusing just on what he wrote about Ammonium Carbonicum.
Right. So our mission here is to unpack what this one particular text says. We're exploring the characteristics, the symptoms, the whole picture, as Boericke describes it. It's like following his specific map,
Yeah, and it's a very detailed map. Wading through it, you find some incredibly specific, sometimes pretty striking observations. It really gives you a window into, into the kind of meticulous detail in this sort of source.
Definitely. So let's get into it. What jumps out right away from Boericke's description is the general characterization of the person.
Who is this Ammonium Carbonicum person, according to the text?
Well, it often points towards stout women. Describes them as being quite tired, weary, prone to catching colds easily. There's this feeling of a system that's just easily overwhelmed.
That weakness theme sounds strong. He mentions a tendency towards being sedentary, slow reaction.
Exactly. Sedentary lifestyle, slow reaction. And here's a really specific detail. Cholera-like symptoms, but specifically before the menses.
Wow, okay. That's precise timing.
It is. And another little detail, maybe puts it in historical context, is the frequent use of a smelling bottle.
Right. Physically, beyond being stout.
The text mentions a weak heart, often wheezing, a feeling of suffocation.
And they're very sensitive to cold air, you said.
Very sensitive. And one of those details that really makes you pause, it's a great aversion to water. It says they can't bear to touch it.
That is specific. Feels almost symbolic, doesn't it? That kind of sensitivity.
It really highlights this general vulnerability, I think. The text also uses phrases like heaviness in all organs, and this rather stark description, uncleanness in bodily habits.
Okay, that's not a modern term. What do you think that points to in this context?
Well, within this text, it seems to suggest a general lack of vital reaction, perhaps, a kind of sluggishness.
Right, like things aren't being cleared out or processed properly. Makes sense.
Yeah, and there are mentions of swelling in glands and elsewhere, and a note about acid secretions.
And underpinning all this is prostration from small things.
Exactly, prostration from trifles. Any little effort just wipes them out.
Which ties right back to that initial idea of a weak, easily overwhelmed system. Okay,
Yeah.
So that's the general physical state. What about the mind? The emotional side. What does Boericke say there?
He describes the mind as, forgetful and ill-humored.
Okay.
Gloominess is mentioned, specifically tied to stormy weather. Also sadness, weepiness, and a tendency towards being unreasonable.
But wasn't there something really specific about sensitivity here too?
Yes. This is interesting. The text says that talking and even hearing other people talk affects them greatly.
So it's not just physical sensitivity like to cold or touch, but even sound, like conversation.
Exactly. It seems to highlight this peculiar vulnerability to, external stimuli generally. It's got this mental, emotional dimension described in the text.
Fascinating. Okay, let's shift gears. How does this overall picture show up in specific physical symptoms? System by system, as Boericke lays it out. Let's start with the head.
Okay, head. The source describes a pulsating feeling in the forehead.
Right.
And the key thing here is the modalities, what makes it better or worse. It's listed as better from pressure and being in a warm room.
Got it. Anything else for the head?
Shocks felt through the head are also mentioned.
Okay, moving down to the eyes.
Eyes, yeah. Burning sensation, aversion to light. There's eye strain, asthenopia, and the text actually draws a parallel here to Napmer.
Interesting comparison.
And soreness at the corners of the eyes, the canthi.
All right.
Ears.
Hardness of hearing is one symptom. And here's another one of those really unusual linked symptoms.
Oh.
Shocks felt through the ears, but also the eyes and the nose, described as happening when the person gnashes their teeth.
Wow. Grinding your teeth causes shocks in your eyes and nose. That's highly specific.
It really is. It's these kinds of connections across systems that are so striking in this text.
Totally. Okay, the nose. You said this section was pretty detailed.
Yes, quite a bit here. The nasal discharge is described as sharp, burning, almost acrid.
Okay.
A really key symptom is stoppage at night, often part of a long-lasting cold a coryza, making it hard or impossible to breathe through the nose. This includes snuffles in children.
Stoppage at night, got it. What about nosebleeds?
Epistaxis, yes. Mentioned with very specific triggers, according to Boericke, happening after washing and after eating.
After watching and after eating. That's
Okay.
specific again.
It is. The source also describes ozana, that chronic, often smelly nasal discharge, specifically with bloody mucus. And it notes the tip of the nose can be congested. So lots of potential nose trouble described here, from blockage to discharge.
Definitely a key area in this picture.
Okay, how about face, mouth, throat?
Around the mouth, the text mentions tetters, sort of eruptive skin things, and it notes boils or pustules can pop up on the face during menses.
Hormonal link there.
Seems so. And the corners of the mouth are described as sore, cracked, and burning.
Okay, inside the mouth.
Significant dryness. Mouth and throat both feel very dry. Toothache is listed. And that remarkable symptom comes up again.
The teeth gnashing one?
No, the pressing teeth together, sending shocks through the head, eyes, and ears.
Right.
Yeah.
Its repetition really underlines its importance in this symptom picture, doesn't it?
It certainly seems to. Other mouth things, small vesicles like little blisters on the tongue, a sour or metallic taste, and a cracking feeling in the jaw when chewing.
Okay. And down into the throat.
Enlarged tonsils and glands in the neck. A burning pain described as running all the way down, and there's a noted tendency towards gangrenous ulceration of the tonsils.
Oof, that sounds serious.
Yeah. And diphtheria is mentioned too, specifically linked to when the nose is severely stopped up, connects that infection to the breathing obstruction symptom.
Right, framing specific diseases within this broader symptom pattern. Okay, let's keep moving down. Digestive system, stomach, abdomen.
Pain at the pit of the stomach is described, often comes with other things like heartburn, nausea, water brash that's like watery fluid coming up, and chilliness.
Okay, and appetite.
Ah, yes. Interesting note here. Appetite is described as great, but they get full really easily, eat very little, and they're satisfied.
Flatulent dyspepsia is mentioned. Indigestion with gas.
Yep, that's in there. Also, noise and pain in the abdomen, and even mention of a flatulent hernia.
And the stool.
The description is specific.
Right.
Difficult, hard, and knotty.
Okay. Any mention of piles?
Yes, piles are mentioned, particularly bleeding ones, and noted as being worse during menses. Itching around the anus, too, and protruding piles described as worse after a stool, but feeling better when lying down.
Got it. Next up, urinary system.
Frequent urge to urinate is noted. Involuntary urination, too, especially at night.
Bedwetting, basically.
Seems like it. Also, tenesmus, that feeling of needing to go urgently, even if the bladder's empty. And the urine itself. The text says it can vary. White, sandy, bloody, copious, meaning a lot of it turbid or even fetid.
Quite a range. Okay, genital symptoms, male and female.
For males, Boericke lists itching and pain in the scrotum and along the spermatic cords, erections happening without any sexual desire, and seminal emissions.
Okay, and for females.
Itching, swelling, and burning of the pudendum, the external genitals, and leukorrhea, a vaginal discharge, described specifically as burning, acrid, and watery.
Sounds like comfortable.
Yes, and interestingly, an aversion to the other sex is also noted here.
And the description of menses itself sounds quite detailed.
Oh, very. It's laid out with specific characteristics.
Okay.
Too frequent, profuse, early, copious, clotted, and black in color.
Wow.
And they come with colicky pains, that hard, difficult stool we mentioned before, and a very particular kind of fatigue. Yes, fatigue, especially in the thighs, along with yawning and feeling chilly.
Fatigue in the thighs, specifically linked to menses. The level of detail is something else.
It really is.
All right, respiratory system. Sounds like another area with a lot of specific.
It is indeed. Hoarseness is present. And the cough. The cough has this incredibly precise timing.
You mentioned this earlier, right?
Yes, it's described as happening every morning around 3 o'clock.
3 a.m. cough.
Wow. And this cough is linked to dyspnea, difficulty breathing, palpitations, a burning feeling in the chest, and it gets worse when going upstairs or uphill. The chest itself can just feel tired.
Emphysema is listed too. Suggests chronic lung stuff.
Right. And there's significant oppression in breathing with really clear triggers or aggravations.
Like what?
Worse after any physical effort, worse when entering a warm room from the cold, and worse when ascending even a few steps. The text also describes something called asthenic pneumonia, that's pneumonia marked by weakness. The breathing is described as slow, labored, stertorous, kind of heavy, noisy breathing with a bubbling sound in the chest.
Sounds serious.
It does. Winter catarrh, like seasonal bronchitis, is noted too. Slimy sputum, maybe with specks of blood. And pulmonary edema fluid in the lungs is also included in the description.
And the heart. Does the description there fit with this weak, breathless picture?
Absolutely. The source mentions audible palpitation, like you can actually hear the heartbeat.
Whoa.
And it often comes with this whole constellation of other symptoms: fear, cold sweat, lacrimation, tearing up inability to speak, loud breathing, and trembling hands.
That sounds awful.
Yeah. It emphasizes a weak heart overall and waking up at night struggling to breathe with palpitations.
Okay. Let's move down to the limbs, the extremities.
Tearing pains in the joints are described. And interestingly, the text notes these feel better from the heat of the bed. There's also an inclination to stretch the limbs.
Heat helps the joint pain. Okay.
Hands can be cold and blue, with veins looking really distended. Fingers might swell up, especially if the arm is just hanging down.
Any specific conditions mentioned?
Yes, quite a few. Panorrhecium, that's a deep infection, often in a finger or toe, described here with deep-seated periosteal pain, so pain in the bone covering.
Ouch.
Cramps are noted in the calves and soles of the feet. A painful, swollen big toe is mentioned, which, might suggest something like gout. Felons, another kind of deep infection near the fingertip, are mentioned as being present in the beginning.
Okay.
The heel is described as painful just from standing on it, and there's tearing pain in the ankle, and the bones of the feet, again, noted as feeling better when warm in bed, just like the joint pains.
Consistent pattern there with warmth helping. Okay, nearly there. Sleep and skin.
Sleepiness during the day is listed, and then there's this very dramatic, very specific symptom.
Yes.
Starting from sleep, feeling like you're strangling or suffocating.
Gosh, that sounds terrifying.
Doesn't it? For the skin, violent itching and burning blisters are described. Also, a scarlet fever-like rash and miliary rash, that's the small red spotty rash, often from heat.
Okay.
Malignant scarlatina, a severe scarlet fever, is listed. And also faintly developed eruptions, which the text attributes to a lack of vital force, tying it back to that weakness theme.
Right.
Erysipelas, that bacterial skin infection, is mentioned specifically in older people, especially if it comes with brain symptoms. And eczema is noted in specific spots: the bends of elbows and knees, between the legs, and around the anus and genitals.
Very specific locations again. Okay, finally, Boericke includes modalities, relationships, dosage. What does it say makes symptoms worse or better?
Right, the modalities listed as making things worse are evenings, cold and wet weather, putting wet compresses or applications on, washing the body generally.
Washing again, that aversion seems key.
It does. Also worse between 3 and 4 a.m., there's that specific timing again, and during menses.
And what makes things better?
Improvement is described when lying on the painful side and also lying on the stomach, and generally feeling better in dry weather.
Okay, dry weather good, wet weather bad. Makes sense with the cold sensitivity. What about relationships to other remedies in this system?
Boericke states ammonium carbonicum is considered inimical, basically, incompatible or clashing with lachesis.
Good to know. Any similar remedies mentioned?
Yes. Remedies noted as having a similar action or symptom picture are reris, muriatic acid, and tartar emet. And the listed antidotes, things that supposedly counteract its effects, are arnica and camphor.
Right. And there's a specific use mentioned too, wasn't there? Something historical.
Yes, the text lists it as being particularly useful in cases of poisoning by charcoal fumes.
Interesting. And lastly, any dosage guidance in this source?
It mentions that the lower potencies tend to deteriorate, lose their strength with age. And it states that the 6th potency is considered the best for general use.
Wow. Okay. We have really walked through Boericke's description piece by painstaking piece. It's like assembling this incredibly complex mosaic from hundreds of tiny specific tiles.
It really is. And it just underscores the value of going straight to a specific source like this sometimes. You get such a deep appreciation for the level of observation, the cataloging involved, how the substance gets characterized, symptom by symptom, modality by modality, within this particular knowledge framework.
Absolutely. That granular detail is just something else. So here's something for you, the listener, to ponder after this deep dive. Think about the sheer kind of observation that's recorded so meticulously in texts like Boericke's. Consider how these seemingly disconnected symptoms get linked together, like that very specific connection between gnashing teeth and shocks felt across the head, eyes, and ears.
Or the precise timing of that cough at 3 a.m. Or even that really strong aversion to water. Makes you think, doesn't it? About the nature of detailed symptom description.
and how certain points become significant enough to document and associate so specifically with one substance within this kind of medical text.